Firstly, evolution is real, right? So the bacteria will evolve. So step number one, you get sick, you've got a major illness, we give you the antibiotics, and when you're beginning to feel better, you think, well, I don't need to take them anymore, I feel better. And then gradually, the antibiotic level in your bloodstream drops, and there's a few bacteria left. And they're living in a low level of this antibiotic, and some of them will think, oh, that's nice to eat, and eat it, and mutate a resistance to it.
So they sort of adapt to it.
They adapt to it, they evolve to it. Because whereas humans, 20 years is a generation, for bacteria, 20 minutes. And so those 2 days, there'll be many generations, and there'll be one mutation in just one bacterium that thinks, oh, I don't mind this antibiotic at all. And if it can survive, and then it can pass the resistance on. So it's us humans, the first factor is we humans are not good at taking our antibiotics all the way through to the end of the course. That's one factor.
Let's just back up.
Yeah.
What does an antibiotic do?
It kills the bacterium by finding something in the biochemical pathway that the bacterium has that we don't. So, for example, bacteria have a cell wall. We've got a cell membrane, and they've got a cell membrane, but they've also got a cell wall. So some antibiotics look exactly like the chemicals that they use to build the cell wall. And they build the cell wall with, say, this penicillin-type chemical, and it's almost perfect, but not quite, and it has holes in it, and it leaks. And so they find a pathway that they have that we don't, and it kills them, and it doesn't kill us.
OK, so if you have an infection that you can't get rid of, you go to the doctor and say, it's just, I'm getting sicker, or it's not going away, that's when you'd be prescribed antibiotics. Yeah,
if it's a bacterial infection. We have got lots of drugs, we used to have lots of drugs, I'm sorry to say, against bacteria. Viruses, a handful, just a handful.
So you're saying the resistance is increasing because what we're being overprescribed, we're taking too many antibiotics, or we're not completing the courses, or all of the above?
Both of those. That was the first factor with the humans, not taking them properly. Number two, the plasmid. Number three, in America, what percentage do you reckon of antibiotics go to animals? Pick a number. Just guess.
As a percentage?
Yeah, percentage.
But probably over 50%.
80.
Wow.
80. Yeah. In 1948, it was discovered with a bit of slightly dodgy science that antibiotics acted as a growth accelerator in animals, and they were claiming figures of 50%. And so very rapidly, antibiotics got fed to animals and wasted. And so we've found out since then that it's not 50%, it's more like 5 to 12%. And in fact, we don't know how it works. And Europe has banned antibiotic use to animals since 2006, except for 2 specific antibiotics that in special cases can be given to poultry, but basically banned. And so we've got this resistance growing like crazy in the animals, and basically we've squandered a medical miracle just to maybe increase animal growth by a few percent, which we could have increased by other ways.
So are you of that school of thought that it's not a matter of if, but when we reach the point that antibiotics become useless?
Antibiotics will become useless, but there are other ways around it. They will become useless as the bacteria get more and more resistance, and all we're left with is a really nasty antibiotics that have got terrible, terrible side effects, and we just can't give them. And so we'll end up with a situation where you can be gardening or just doing a bit of renovation, and you get a cut and you die, like you used to.
Because there's a yin infection in the cut and something to treat it.
And we don't have the antibiotics anymore. But there is a hint on the horizon, bacteriophages. Bacteriophages are a virus, and they look like a little moonlander, spindly little legs and a body, and they land on the round body of a bacterium, inject something into it and take it over. And the figures are this. Every 2 days, these viruses, called bacteriophages, kill half of the bacteria on Earth every 2 days, which then grow back immediately. You would have a different bunch of bacteriophages, viruses fed to you, than would your daughter or family. The advantage is that they're alive. And as the bacterium mutates, the bacteriophage can chase it down. We haven't got there yet. That's our light at the end of the tunnel. Let's throw money at the scientists.
All right, well, meanwhile, who's responsible if we're going to use less antibiotics?
Yes.
Is it up to the patient or the doctor?
Both. Many patients insist on getting antibiotics, and there are some doctors who are not perfect, nobody's perfect, who overprescribe, and we're trying at both ends to try and reduce the amount of antibiotic use among humans when it's not necessary.
Dr. Karl, thanks very much.
Thank you.